Great, thanks very much, Reed. Good evening and welcome to everyone joining us on this webinar. We're very happy to have you joining us for this conversation about the Opera Stabilization Grant that will be forthcoming. Before we get started, I just wanted to take a minute and do a couple of quick polls to see who's in the room tonight. We will be focusing primarily on the FCC components of the way the formula will be implemented, but we'll also be happy to talk to other aspects of the formula as is relevant to those participating. So Sarah, would you be able to start the first poll? So there are two questions here. The first is, what type of program are you associated, or what affiliation do you have with childcare? In particular, we're interested in whether you're a family childcare provider, if you work in group and school age, center-based programs, if you're from out of school time or after school. We also recognize we might have some from residential placement programs and some advocates or partner organizations at the table. And then the second question is just to understand what region you're from. I'll just wait till everybody's had a chance to join in. But looking as the results as they come in, it does look like the majority of participants are from family childcare, but we do have some group and school age and some center-based participants. So we will make sure we continue to touch upon those components of the formula as well. The other thing, to just share while the poll is coming in, we are going to use the Q&A feature of the webinar. You can write questions in, and those will be sent to the panelists to answer. We won't answer every question as it comes in. Certainly, I will try to track the chat and the questions that are coming in as Jeff is presenting. And we'll call out any questions that are sort of essential clarifying questions related to the slide that he's talking about, but we will save larger questions to discuss at the end, because certainly sometimes questions do come in early in the presentation that we will answer later on. So encourage everybody to put questions into the Q&A. And we will get to them as we move through. So again, I'm just going to quickly share the results so everybody can see. Is that happening effectively? I think so. So majority of participants are family childcare, and we do have representation from all regions across the state. Okay, so I'm going to stop that and jump into the presentations. So to set context for this conversation, I just wanted to review the different grant funding pools of funds that are coming to the Commonwealth of Massachusetts, and then identify that we are focusing in on the use of the ARPA childcare stabilization funds, but we are also receiving CRRSA CCDBG funds and ARPA CCDBG funds. I'm not going to get into the details of those other two funding sources tonight. But each of these funding sources comes with different requirements about when they need to be spent and how they needed to be spent. And Jeff, if you can click one more time for my animation. We are focusing tonight on the ARPA childcare stabilization funds. These funds are required to be spent first. And there's also an expectation that 90% of these funds must be distributed as direct grants to providers. So this has provided us with a nice opportunity to support the six months of direct grants that we want to provide to providers to support their operational capacity. This has also allowed us to use a non-appropriation pathway to get these funds out. We will have to wait for legislative appropriation for the CRRSA and the ARPA CCDBG funds. Can you go to the next slide? So to dig a little bit more deeply into the federal requirements of the stabilization funds, again, as I said, states must distribute 90% of funding as direct grants to providers, which is our intent. We also need to obligate, which means we need to have promised to particular people that we will give the funds away. As promised, we must obligate at least 50% of the funding by December of 2021. So with the 6-month grant structure that we're considering, we would be well past that benchmark at that point in time. There are also some eligibility requirements written into the federal language that enabled this funding. First of all, to be eligible, you must be either licensed or approved as of March 11th, 2021. It does not matter whether you were open or closed at that point in time, just that you were licensed or approved to operate at that point in time. At the time of application, programs do need to be open or in only a temporary COVID-related closure. And at this point in time, I just want to remind everybody that since the state of emergency has ended in Massachusetts, providers that were in what we had called the emergency closure status since last March are no longer considered closed as per the COVID emergency. And to reopen, you should reach out and contact your licensor. Those programs will just be considered closed. And unless you reopen, you would not be eligible for grant funding. So some of the key features of the funding proposal that we are putting forward is to use at least 225 million and maybe up to 283 million, which is the 90% required by federal statute of the total ARPA funding in direct grants through this program. We plan to distribute the grants in 6 monthly payments. It would begin with a payment for July, and have calibrated the grant funding to be a percentage of operating costs. And in our calibration, we were targeting about 10% of the cost as baseline, using cost information that we had gathered during the strategic planning to help us identify what 10% would look like. Funding amounts will be distributed by a formula that Jess Lambert from Third Sector will talk about in a minute. And this includes accounting for capacity and staffing costs to identify a base funding amount. This will operate in addition to current state funding. So this does not replace or alter the existing subsidy funds that programs receive. This operates in parallel to the subsidy funding. And this will be available to all licensed providers that meet the eligibility criteria above. So that includes providers that do not serve subsidy children, both center-based and FCCs. All providers will be able to apply and receive the grant, and the funding applied to each provider will be based on capacity and adjusted to account for equity. And in thinking about our goals for the grant, we are focusing on a few guiding principles. So we want to provide funding that creates a foundational level of financial stability for programs to help programs continue to operate. And we want to make sure that they're adequate to sustain healthy finances. We have heard from many, many programs that this continues to be a very difficult period. And while we expect enrollment to start trending upward, we know that enrollment has fluctuated greatly. And so we do want this fund to, again, provide stability against those enrollment fluctuations, so that we are not trying with this funding to replace all of the lost revenue from tuitions. We also have a goal of equity. So we will focus on bolstering capacity in vulnerable and minority communities, and also expect that this funding will support minority-owned businesses through that approach as well. And finally, we are trying to keep the process as simple as we can and avoid creating a heavy burden for providers, while also balancing the fact that we do want to collect information that we can use to understand the success of this grant funding, and if successful, talk about the successes and demonstrate the ways in which this funding has worked. Can you go to the next slide? So we have been talking about this, what we've been calling the C3 formula, which is at the base of this grant for a while, and have been working with Third Sector since actually before to think about how to design this, and drawn from work that was done actually prior to the pandemic, when we were in the strategic planning efforts we were conducting at that time, and thinking about better ways to provide stable funding sources to programs. The COVID has obviously just reinforced the need for this type of stability in the childcare field, and provided us with an opportunity to try out a different financing model. As we've been talking about the funding model, we've gotten some key feedback from the field. For one thing, we need to ensure that the funds are sufficient to support continued operations. Again, we are not trying to replace all lost revenue, but we are trying to provide a baseline level of stability. And that the process for receiving funds is clear, simple, and straightforward. So we continue to use opportunities like this to communicate about how the funding is structured, and we'll continue to support the field past this point in continuing to understand the formula, its implications, as well as when we get to the point of designing and launching an application to support the field in understanding and accessing that application. Finally, as we have been talking about the equity adjustment, where we've focused at first on looking at information that we had about program location, the field has said very clearly to us that that cannot be the only factor that we use to identify programs that are enrolling underserved children and families. So we will also talk about an alternative pathway to achieve the equity adjustment in this grant structure. Go to the next slide, Jeff.
Great, thank you, Jocelyn. So as Jocelyn said, my name is Jeff. I'm from a team from Third Sector. We're a nonprofit based here in Boston. So along with my colleagues, Tasha and Tim, we've been working with EC on the development of this formula. And some of you may have run into us or heard from us before on previous engagement sessions and focus groups. So I appreciate everyone's time tonight to learn more about this approach. So before I get into this, just want to make a few things clear. One of which is we're going to be talking about an application tonight, but it is not going to be a competitive application for funding. EEC has allocated funds for every provider in the state to be able to receive this grant. And so it won't be a competitive application. Everyone who is eligible and submits an application will receive funding. It's just to receive information from you. And we're going to go into a lot of detail about the formula tonight and the different pieces that are part of it. But know that a lot of this math will be taking place in the application, and EEC will be doing it. So you won't need to do a lot of this math yourself. You won't need to look up the location of your program and other data points. And as we walk through, I'll make it really clear what data will be loaded in by EEC. But you will have an opportunity to look at all the information that EEC has about your program. And if you think that something is wrong or out of date, you'll certainly be able to let them know and address that. But the goal is to have the application be very simple and to just report really the critical information that's needed that EEC doesn't already have. And so I'm going to start here talking at just the highest level about the formula. And then we're going to go into greater detail about both the base amount and the equity adjustment. And then we'll actually go through a few case studies of some example programs to see exactly how this all works out. So starting with the base amount, as Jocelyn said, our goal is to provide about 10% of the cost of care for all providers. And we know that there's different drivers of that cost of care, and one of which is certainly the license capacity and the number of children being cared for. Another driver being the staffing level in the program and the personnel costs. And so for family child care providers, really focusing on whether you have an assistant on staff, knowing that's a major driver of costs and also allows you to serve more children and offer higher quality care. Similarly, for center-based programs with more staff, program might be able to offer higher quality care, operate longer hours, or serve younger children with lower ratios. And all of those would increase the cost of care. We want that to be reflected in the formula. And so all providers will receive this base amount, we're calling it. So what you're seeing here on the left side, which is the $500, and that's across the total. We're going to switch back and forth tonight between talking about the total amount that you'll be eligible for, as well as the monthly amount, just put in perspective. As Jocelyn said, this will come out as 6 payments across 6 months. So the total amount would be $500 per slot times that license capacity, and then the staffing level adjustment. Again, we'll go into this in greater detail in a moment. So all providers will receive that base amount. And then certain providers who are serving historically marginalized and under-resourced communities will be eligible for additional funding, either 30% if they're receiving the level 1 adjustment, or 40% additional funding if they're receiving the level 2 adjustment. And we'll go into exactly how that plays out. I won't focus on this since I know that the attendees tonight are mostly family child care providers, but just to quickly note, for center-based providers, we will be looking at the total CEO compensation relative to starting educator pay. And for those providers with a ratio greater than 40:1, so that'd be a CEO salary of roughly $1 million, they would not be eligible for either the staffing adjustment or the equity adjustment. So they'd just be receiving that $500 per slot, but that won't impact many providers and certainly won't be impacting family child care providers.
So far, questions that we've gotten are focused on largely on the application process. And then some questions on the SVI, which I think we can dig into once we get to the slides particular to that.
Great. Yeah, I'll definitely go into more detail about the Social Vulnerability Index when we talk about the equity adjustment in just a moment. So here's a little bit more detail around that base amount. So again, starting with $500 per license slot, that's $83 per month across 6 months. And if you're wondering where that number came from, again, as Jocelyn said, we were targeting that 10% cost of care once all these factors are wrapped in, as well as making sure that there were going to be sufficient funds for every provider in the Commonwealth to be able to apply and receive funds. And here for the license capacity, want to make a specific note for family child care providers. And so regardless of your actual license capacity right now, all eligible family child care providers, we're going to be using 10 as the number of children or number of slots for the purposes of the formula. And so this doesn't mean you need to expand your license capacity or hire an assistant or make any changes. This is for the purposes of the formula only. All family child care providers will be getting credit for 10 children. And this really comes from that value that Jocelyn stressed around simplicity and ease of application. Wanted to just make this as easy as possible, especially for family child care providers, and also give family child care providers the benefit of the doubt. And so for each family child care provider, the formula will start with this $500 per month times 10. So that base amount will be $5,000 for all family child care providers before the staffing level adjustment. And for family child care providers, the staffing level adjustment, it's going to be multiplied by one of 3 numbers. And so if you have no assistant, you won't receive this adjustment. And so that you'll have a $5,000 base amount. If you have a part-time assistant, we'll multiply that $5,000 times 1.5. If you have a full-time assistant, we'll multiply that $5,000 by 2 for a total of $10,000. And so that's how the base amount will look for family child care providers, taking into account whether or not you have an assistant on staff. For center-based providers, we're looking at something very similar. So here it would use the true license capacity of the center would be what's being used in this formula. And then adjusting so that providers with more staff will be receiving a larger adjustment. And this adjustment won't penalize any center-based providers. You'll always receive at least that base amount of 500 times your license capacity. But for providers with additional staff, could receive additional funds up to 3 times the funds, depending on the number of staff they have. So I'll probably leave it there for now, and we'll go into it in a bit more detail when we go into the case studies, since I know the majority of the crowd here tonight is family child care providers. But again, just to note, both family child care providers and center-based programs are starting with that same $500 total per license slot. Any questions you want to address here on the base amount, Jocelyn, before we go into the equity adjustment?
No, I think just one general response to everyone is that everybody is eligible. If you meet the federal eligibility requirements, you're licensed at the point in time required by the feds and open at the time of application, any provider is eligible for these funds, regardless of whether you're serving subsidized children or not. And the other thing too, there was a question that came in about not receiving children from an SCC system. We aren't looking at enrollment at any of this. We are really looking at your license capacity to calculate this base amount. I'll talk further about that when we get to the equity adjustment and how we're looking at subsidies. But for this base amount, everyone is eligible regardless of whether you serve children with subsidies, and it is based on capacity. Or in the case of the FCCs, the 10 that we recognize is not everyone's capacity number, but a standardized number that we're using to calculate the FCC amounts.
Yeah, that's a great point, and a good thing to emphasize for those of you who are joining us who do run center-based programs, that we will be using the capacity, not the current enrollment, since we know the enrollment may be impacted by COVID and may not have come back yet. Great, so now we'll talk in some more detail around the equity adjustment. And again, as Jocelyn stressed, the goal here really is to reward all those providers across the Commonwealth who are enrolling underserved children and families. And we know that there are many programs who may be in more affluent areas or middle class areas who really do great work to reach out to and enroll and serve underserved children and families. We want to recognize those programs as well. So we'll go through kind of these two different pathways to qualify for the equity adjustment. But know that beyond this, there will also be a process where you can submit an appeal with some information about the children you're serving to EEC. If for some reason you think that either the location of your program or the number of children in your program who are receiving subsidies, if for some reason those two don't capture the population that you're serving, you'll be able to submit additional information for EEC for consideration to receive this equity adjustment. So now I'll start first with the first avenue to qualify for the equity adjustment, which is based on the location of your program. And so this approach is using the Social Vulnerability Index, which is something developed by the CDC. You may have seen it used in the vaccine distribution and delivery. Many state agencies are using it for responding to COVID and disaster relief more generally. It's a tool that's been around for a while. And the Social Vulnerability Index takes into account 15 different variables. And so it looks at variables like the unemployment rate in a community, as well as the proportion of residents living in poverty. It also looks at factors such as how many residents have access to a car, or how many residents in a community are living in crowded housing, the English language proficiency within a community, to give a holistic sense. And these scores are from 0 to 1. They're only relative to Massachusetts, so not comparing against Connecticut or Mississippi or anywhere else in the country. And these scores give us a good starting sense of the barriers to success the community might be facing. And so just to give a little bit additional detail for those who are interested, we'll be evaluating this by looking both at the census tract, which is a pretty small unit, geographic area, as well as your zip code. And so whichever of those has a higher SVI score will be the SVI score that we'll be using in the formula. And that's, again, really coming from a place of wanting to give providers benefit of the doubt and to ensure that there's not any outliers, and we're really capturing as many programs as we can who are serving these under-resourced and historically marginalized communities.
All right, so we have,
go ahead.
Oh, sorry. Were you pausing for me or just pausing to take a breath?
I'm pausing for you in case we saw a few questions come in, so not sure.
Yeah, no, we've got quite a few questions actually at this point, and some of them do go back. So I think I will take a pause and try to work through some of them. So questions related to the equity adjustment. One question is asking about sort of what it is that we're thinking about in making this equity adjustment, in particular in the unique needs of providers in these communities. I think that there are a number of factors that play into the desire to better support these communities. We do, first of all, recognize challenges that families in these communities can face in accessing quality childcare, and want to be sure that this funding is being used to maintain and support access for families. We also do recognize that the tuition rates that families can pay in some of these areas will certainly be lower than in other areas. So we are also trying to recognize additional constraints that exist in those communities for providers. But primarily, it is a goal from the state's perspective to make sure that these communities are adequately served in places where the private market might not be the most effective way to do so. In terms of finding out what your SVI adjustment is, which a couple of people have asked about, I do have to apologize. The CDC does have a map. It is not the most transparent way to understand what your SVI is. We are actually working through the process of calculating the SVI at both the census tract and the zip code level. So, sort of the area right around where your site is located, as well as a slightly broader zip code area, and are working on gathering that information so we can make that available for providers specifically in Massachusetts, but we don't yet have that ready.
But again, that's something that will be available to look up, but you won't have to look that up, right? It's EEC will look it up for you, and you'll be able to see it in the application when you apply.
Yes, and I think on some of the questions about, sort of how are we calculating the subsidy component of this. First of all, it is going to be based on placement because we do recognize the challenges that continue around enrollment. We also, these are two pathways, as Jeff said. You can get the funding through either pathway. You don't have to meet the requirements of both. So even if you don't have the enrollment that you would like on the subsidy side right at this time, your SVI location might also qualify you. We also are looking at 2 different time points for subsidy enrollment. So just sort of reminder of that. We can look at the pre-pandemic subsidy enrollment prior to, so we're going to look actually, I believe, at February 2020 or at May 2021. And again, allocations would be determined on the highest percentage of your license capacity enrolled at that time. A question about the intent has come through. Is it meant to stabilize childcare due to the effects of pandemic or stabilize childcare in general? This is COVID-related stabilization funds that we're using. So the primary goal of this grant is to stabilize childcare as a result of in recovery from the pandemic. It also does provide us with an opportunity to learn about this method of funding programs as a way to provide financial stability to the childcare field in general. So we do actually have 2 different agendas in that. Also a reminder, some people are asking, well, what if your children come from other locations? You do have the option, as Jeff has said, if the information that is presented in your application is not accurately capturing your program as you understand it, you do have the option to come back to us and say, well, actually, let me show you where my children are coming from. I can show that, in fact, this program, despite my location, this program does serve a high percentage of children coming from low SVI locations, for example. And then there were a couple of questions going back to the 500 and the 83 amount. Jeff, can you jump back quickly?
Yeah.
So just to clarify again, I know this is confusing because we can calculate this one of 2 ways. We can look at how much your total grant amount would be across the 6 months, or we could look at monthly payments, and both are useful for different reasons. The 500 per license slot would be to calculate the total amount that one would get over the 6 months. And again, that's the beginning of the calculation. There continue to be other parts of it. So that's not the total amount that you would receive. That's the base of the calculation. 83 is the amount that you would receive per month per slot. So effectively it's 500 divided by 6. It's taking the 500 slot number and breaking it down into how much you would get per month per slot. Thanks, Jeff.
No problem.
Great. I will stop there and keep scanning, but go ahead.
Perfect. Sounds good. Well, yeah, thank you for those clarifications, and as well as alluding to the next pathway to qualify.
Sorry,
for the
I jumped
bonus.
ahead. I stepped on your
There's a really good explanation. So I will just quickly recap that. So, as Jocelyn was saying, the other pathway to qualify would be based on the percentage of your children receiving subsidies. And just to reiterate what Jocelyn said, these are independent criteria. You can have either one. So you can either qualify based on your location or based on the percentage of your children receiving subsidies. And that's true for qualifying across different levels as well. So if you only had, 1/3 of your children receiving subsidies, so you would be in the level 1 bonus, but you are located in a high SVI area with an SVI score greater than 0.75, you would qualify for this level 2 bonus. So it's, again, giving you the benefit of the doubt, whichever one is higher is what you would qualify for. So this is just a different way of looking at that same idea that might be more useful for some of you. So each of these dots is a center-based program, but if we had family child care programs here, you'd see a similar distribution. And so on the horizontal x-axis, you can see the social vulnerability index scores. And on the vertical axis, you can see the percentage of children receiving subsidies. So again, you can see the way that these 2 levels of the equity bonus function. And so there's a number of dots here you can see down here in the bottom right corner, with a very low percentage of children receiving subsidies, but they're operating in high SVI communities where they're serving under-resourced communities and providing that critical childcare supply, but for one reason or another not taking a significant number of children receiving subsidies. And so we would still want them to qualify for the level 2 equity adjustment. And you can see how the two pathways intersect here to qualify for both level 1 and level 2. And lastly, before we get into some of the case studies, just wanted to really make this point, especially to this audience with so many FCC providers, that family childcare is really critical to the childcare supply in under-resourced communities. This graph is showing the number of providers in communities broken out by SVI. So you can see here, these two bars on the right are communities with an SVI of 0.6 to 0.8 and then 0.8 to 0.1. You can see the really large number of FCCs located in those communities. And so many FCCs will be qualifying for the equity adjustment. And we think that this is a really important investment in the childcare supply in these communities that we know are more likely to be childcare deserts and more likely to be serving children and families of color. Any burning questions we should jump into before the case studies, Jocelyn?
I think it's just a few more clarifying questions around where information is coming from and how the formula is calculated. So a number of questions have come in about where we'll get information. I'm reluctant to answer questions about a specific program just out of cautiousness that I might not have the full picture, and I don't want to lead anybody astray about their particular program. But I will say, again, you do need to be licensed and approved by EEC as of March 11th. If your approval came in later than that, but you feel that there are extenuating circumstances, you will have the opportunity to contest that designation. And we can certainly have a conversation with you about your particular circumstances. In terms of the staffing adjustment, a question came in about what requirements one needs to have to prove that you have an assistant. We are not going to be collecting paperwork, but we will be asking in the application about your assistants. And one thing that we are working on right now, and as part of our longer term goals, to link the registry to our licensing system, we may ask for the provider IDs of your assistant as well. And I feel like there was one more. I just want to make sure. In terms of how the funds will be distributed, we actually have not fully worked that out yet. We're in the process of working with our vendor to identify that. So more information will be forthcoming on that. And I do think I also addressed questions about, what if you don't fit neatly into these categories and would like to contest our designation. But the licensing information will come from LEAD, and we will gather it at the point in time when we put the application together. And the subsidy information will come from our subsidy system. So we're not except for the questions that we're asking you to complete about your staffing, we're not reaching externally for any information to support the construction of the funding. I think there are other questions about how to use the funds that I'll get to later. So I think I will stop there.
Great. So now I want to look at a specific program. So, this is just a hypothetical program. We know that every FCC is unique and is going to have unique circumstance. But first, we'll look at one example provider that has a full-time assistant on staff. And so again, for family childcare, all providers will be receiving, credit for 10 children as their capacity, regardless of your actual license capacity. And here, the staffing level adjustment will be ×2 because there is a full-time assistant on staff. And so we'll calculate this base amount first. So $500 times 10 for the license capacity ×2 for the staffing level adjustment. And that comes out to $10,000. And so regardless of where this provider is located in the state or the children they're serving, every FCC who applied who has a full-time assistant will be receiving this $10,000. Then we'll look at the equity adjustment. And so here, they're serving between 1/3 and 2/3 of their children are receiving subsidies. So as a reminder, that would be level 1 of the equity adjustment, but they're located in a community with a high SVI score of 0.85, which is above the threshold for level 2. And so therefore, this provider would qualify for the level 2 equity adjustment of an additional 40% of funds. 40% of 10,000 is $4,000. So that would be the equity adjustment. We'll take these two together to get the total amount that this provider is eligible for. That would be $14,000 across 6 months. So if we look at that in terms of the monthly payment, each of those 6 months, that would be $2,300 every month for 6 months. And if we break that down to think about it kind of per slot, again, using this idea of the 10 slots for all FCC providers, we're looking at $230 per month. And again, 6 months worth of payments. And just want to pause to remind everyone that, we're walking through the math step by step here so that everyone can understand what's going into the formula and how these amounts will be calculated. But all you would need to submit is, whether you have a part-time or full-time assistant and perhaps some information about that assistant, as Jocelyn just mentioned. And then you would see this other information populated into the application, and the math and the would automatically happen. And you'd have a chance, if you thought that the percentage of children receiving subsidies in your program was incorrect, you could, flag that for EC and they could review to make sure they're getting the most up-to-date information. But in general, you'll report on your staffing levels, and then everything else will be loaded into the application, and this will all be calculated for you. But we want to make sure everyone gets a real sense of how we're arriving at these amounts.
Thanks, Jeff. I have a couple more questions that have come in that I might just answer at this point. First of all, there is a question that came in from Maria Otaño in Spanish that I would love to have translated, because I think it is similar to a question that was asked earlier that I have not yet answered.
My question is, a program with 2 shifts can receive the payment for both shifts?
So this is coming down to the question of how sort of full-time is defined. We will provide clarification in the application process. Defining full-time is a surprisingly ambiguous task, so we will provide some guidance around how to do that. But effectively, if you have 2 different shifts that are each part-time, together collectively, both of those shifts would equal 1 full-time shift. So you would, for an FCC, that would be the sort of the adjustment as if you had 1 person who was working the full day as an assistant. If there were 2 different full-time shifts, I think that might be a conversation that we could have with you after the application comes in. Our assumption right now is that for most FCC providers, the most that one would have at any point in time is 1 full-time assistant working with you. Again, at any point in time, recognizing that might be multiple people providing that service, but we're really, sort of trying to understand day to day what you have. There's also a question about whether an assistant has to be licensed by March 11th. No, the licensing requirement is just for your program, not for your assistant. I'll get into the details of how the application works, but effectively, we would just want you to report on assistants working in your program at the point of time of application. And please, if I didn't fully answer the shift question, please ask again and I will come back to it. Thanks, Jeff.
Right, so now let's look at a different example family child care provider. And so this family child care provider does not have an assistant. And so for the base amount, we're going to take the $500 times the same 10 children that we're using for the purposes of the formula. Here, there won't be a staffing level adjustment because there's no assistant. So 500 times 10 is 5,000. So again, that's the base amount. Regardless of where this provider is located, they would receive that $5,000. But now we'll look at whether this provider also receives the equity adjustment. So here we can see that both on account of where they're located, being in a community with an SVI score of 0.55, as well as the fact that they're enrolling more than 1/3 of their children are receiving subsidies. Both of those, they meet both of the criteria for the level 1 equity adjustment. As a reminder, you would only have to meet one of these two to get that level 1 adjustment. But here they meet both, and so they'll be receiving that level 1 equity adjustment, which is additional 30% of funding. In this case, that's $1,500. And so we'll take our 5,000 plus our 1,500 for a total payment for this provider of 6,500 across the 6 months. And if we break that into the monthly payment for each of the 6 months, we're looking at just over $1,000 and around $110 per month per slot.
Thanks, Jeff. One follow-up assistant question is whether assistants need to be certified or regular assistants can be counted too. You can count, what we are trying to get at is the staff that you are paying to support you in working with children. So you can account any assistants working in your program. Similarly, in the center-based, we are counting teacher assistants, certified teachers, and certified lead teachers. So we're really trying to capture the full picture of the supports that you have in your program. And I think one other thing that I just want to comment on, there have been a couple of questions asking why we think a certain type of program has a greater need for funding than another type of program. We actually really do not have good information about the impact of the pandemic on individual programs, and we recognize that it is widely variable, and have designed this as an overarching framework within which we feel that we can provide a level of stabilization across the board, but it is not designed to respond to particular programs' circumstance. It is meant to be a consistent source of funding across the field that supports everybody broadly. And yes, sorry, one last question. Sorry.
Oh, no.
It's just the details of this get so complicated. The question about whether family child care providers that have less than 10 children are eligible for the funding, yes. The number 10 is just a flat rate, effectively, a flat number that we're using for all FCC providers to calculate the same base rate across providers, recognizing that we heard from the field that the small differences in who providers are serving and their license capacity are not significant enough, nor necessarily completely in providers' control, so that we decided to take a high number and apply it to everyone. Any FCC that is licensed, regardless of the number of children you're licensed to serve, is eligible to apply if you meet the federal eligibility requirements. Thanks, Jeff.
That's a great clarification. So shortly, I'll turn it back to you, Jocelyn, to talk about the reporting and attestations that will come along with this funding. But I know with it, we do have some center-based providers on the call tonight. So just want to walk through at least one example here of how the funding will work for them. And so this is a case study of a small center-based provider. And so again, this is kind of a hypothetical example, but in this example, we're looking at a provider that has 3 classrooms, 1 infant classroom, 1 toddler classroom, and 1 preschool classroom. And so they have a license capacity of 36. We're also going to make an assumption that this particular provider has 9 full-time equivalent educators on staff across those 3 classrooms. So 3 full-time equivalent educators per classroom. So let's start with the base amount. So the first part is pretty straightforward. We have our $500 per license slot. We have a license capacity of 36, so we'll multiply 500 by 36. The staffing level adjustment is a bit more complicated, but here we're essentially looking at, does the provider have more staff than they would if they were serving only preschool students? And the reason we're doing that is because we know that the ratio is lowest for preschool children, 1 educator for 10 children, and with younger children, you'd have fewer children per educator. So as a reminder, the idea with the staffing level adjustment is rather than ask you to report on the age group of children you're serving, the quality of your care, the amount of hours of care you're providing, a lot of these drivers of costs, we really think that a lot of that is reflected in your staffing levels and how many staff you have on the payroll. And so by looking at your full-time equivalent educators and reporting that, that's really focusing in on the major cost driver and is reflective of these other goals, such as rewarding providers who are operating longer hours, serving younger children, or operating at higher quality. And so in this particular example, we have our license capacity of 36. We're going to divide that by 10, which again is kind of our baseline ratio to get 3.6 educators. We'll round that up to 4. And so in this case, we have the actual number of educators 9 divided by the baseline number of educators 4 to have an adjustment of 2.3. So we'll take $500 times 36 times 2.3 to get a base amount of $41,400. And just as a reminder, the maximum the staffing level adjustment could ever be is 3, so 3 times as much funding, and you won't ever be penalized by this. So if you're a out of school time provider, or you are a provider that has some classrooms closed right now, so maybe even though you have a license capacity of 70, you're only running 2 or 3 classrooms, this won't ever penalize you. So it would never go below 1. So you'd always get at least that $500 per slot. And, again, I think we've seen this before, but here, this provider in this example enrolls a significant number of children receiving subsidies. They receive the level 2 equity adjustment, which would be an additional $16,560 on top of the $41,400 in the base payment. And just a reminder that no one will have to calculate that staffing level adjustment on your own. You'll just be putting in the number of full-time equivalent educators that you have on staff that month. And as Jocelyn said, there'll be some very clear guidance in the application around how exactly to determine how many full-time equivalent educators you have, what type of staff count in that calculation, as well as how to decide, who counts as a full-time equivalent. So I leave that there. I'm seeing a lot of questions come in. So Jocelyn, I'll let you jump in.
Okay. I've gotten a number of questions with different scenarios about, how the SVI might take us astray, or the subsidy estimate might take us astray, a program astray as well. So again, I just reiterate, if you feel that the designation that your program has been given when you go into the application, and again, I apologize that we can't point you right at this moment in time to an SVI calculator for your program, but we are working on that. If you find that when you look at what is in your application, it doesn't feel like this is adequately capturing the nuances of your program or your community, you do have the option to contest that and enter into a conversation with us about how that is structured. And again, for eligibility, it is that you are open. We are not gathering enrollment information as an eligibility criteria. We do recognize that enrollment has been challenging recently. I will get into some of the application details, and some will have to wait for us to finish designing the application. And there was one question on the SVI. Yes, the SVI is based on Census 2018 data. The question was asking whether that was the basis for the SVI. It is based on census data. So we have to use the most recent, it obviously relies on the most recent census data. It is, I believe it is taxable income. Somebody asked about that. But I would suggest that you speak with your accountant about that. I do not want to give misleading tax advice, and it is definitely not my expertise. Just checking to make sure. I feel like there was something else. Oh, sharing assistance. So if you, and this is actually true for both Centerbase and FCC, if an individual works in 2 different programs, each program would include in their calculations the portion of time that individual works for them. So if you share an FCC assistant with another program, both programs would be able to calculate the portion of time that person works for you into their adjustment. And again, your license capacity, whether you have an assistant or not, none of these things affect your eligibility to apply. This application is open broadly. It just might, the presence or absence of an assistant in an FCC program might change the amount that you are allocated, but it does not affect your eligibility for this grant. And I people are suggesting some ways to think differently about the adjustment. So looking at the tier rate for the food program is one suggestion, or the provider's income. I think those are certainly ideas, and we would be happy to enter into a conversation with you if at the point of application that seemed to be something that was worth doing. Yes, nonprofit programs are welcome to apply. All right, I'll stop there and let them pile up again.
Right,
Go ahead,
sounds good. Well, I think in the interest of time, I know we're coming up on 8 o'clock. I probably won't go into another case study for a center-based provider, but as Sarah has shared in the chat, there will be materials posted from the session this morning, which focused more on center-based providers, and we went through several other examples. So if you are a center-based provider and looking for more information, I encourage you to check out that recording. But Jocelyn, I'll probably move to the information on reporting and let you take it away.
Okay, so I know there have been a number of questions that I haven't yet answered about the application process. We just contracted with a new vendor, not the vendor that we worked with on the last application, to build and support the application process with us, as well as the payment process. So details about timelines and the specific processes for the payments will be forthcoming as we work those out. I will say on the question about whether the application will be open in July or not, we are certainly working as fast as possible to get that open. We also do want to make sure that the application functions accurately, particularly because there are a number of complex calculations that will be running in the background. So we are going to balance speed with accuracy. And I can't speak to the specifics of the timeline, but we will set this up so that we do start payments. So the first month that you get paid for will be July, even if ultimately what that means is when you apply, you are applying for 2 months of funding, July and August at the same time. The application itself will be structured so that you enter in at the beginning of the application process. As Jeff mentioned, a lot of the information that we've discussed would be already pre-populated in your application. So the licensing information, your SBI, your subsidy information would already be available to you. You could look and see and review and dispute if you feel that there is something that is inaccurate. But the one piece of information that we will be asking for you that is essential to the formula is your staffing information. And then the way we will work the application over the course of the 6-month payments is just ask for you to check in at your application on a monthly basis. If nothing's changed, you just check a box and say, yes, everything remains the same. I'm still open. I'm still looking for grant payment. But if you have changed, say you've hired an assistant over the interim, you can add that information and update your information, and your grant funding will be adjusted for the rest of the grant period. One other advantage of doing it in 6 monthly payments is not only can you get those adjustments over time, because we do recognize that staffing is fluid, but also that providers who are in the process of reopening and may not be reopened right when the grant starts can still come in at the point in time when they are reopened. The other thing that we do want to accomplish with the information that we're collecting in this application, as I mentioned in the beginning, this is a new way to fund programs, and it's something that we're interested in both as a way to support programs' recovery from the pandemic, but also as a potential approach to providing stable funding to programs. So we do want to collect enough information for us to start understanding whether this is an effective approach to use with programs. So in looking at what we are asking in the application, I just wanted to provide a brief overview. And again, once the application is complete, we will provide additional supports for programs in going through the application. The other layer of support that we're working on right now is we are in conversations with some of our partners about additional ongoing supports, both in terms of understanding this formula and what it means for you, as well as supports with the application process that are broader than those that we can provide. So we're talking with Strategies for Children, for example, and SCIU about providing some of those supports. We've also gotten a lot of interest from some of the FCC systems, and as well as CCR&Rs. So we are going to try to work with as many partners as we can to provide as many supports as we can in this process, because we recognize that there's a lot of information that we just shared with you, and it may take some time to process and fully understand. But in the application, just to give you a sense of what to expect, again, balancing our need for simplicity and not making this too onerous, but also getting the information that we need. We will be looking for information for center-based on the classrooms you have open for everybody, current enrollment, and any scholarships that you provide, because that is certainly something that many people have brought up as a resource that they provide their families that we really do, they want EEC to recognize and credit. We will be asking for information about the number of educators you have working with you. We do also want to understand compensation. One of the goals of the funding is to stabilize program finances so that investments can be made in quality. And we recognize that educators are the primary driver of quality, that really that is the heart of quality, your capacity to hire and maintain strong staff. So we do want to understand what compensation is at the beginning of the grant and the extent to which programs are able to use funding to increase educator compensation. Not necessarily in salary. We do recognize that that's challenging with temporary funding, but we do also want to understand the ways in which stipends and other types of bonuses are used as well. We will ask programs to confirm the information on the consumer webpage, both the rate and the hours of operation information, because this allows us to also understand the extent to which this grant is supporting the maintenance of accessible programs for families. So the ways in which programs are available to families and the cost of programs to families across the state. It is a federal requirement that we ask about the race, ethnicity, and gender of either the FCC operator or the center director. So you will see that in the grant application as well. And finally, there are some federally required attestations that I just want to call attention to. I'll talk in a minute about the the sort of federal requirements around how you use the funding, which there's a fairly extensive list, so it actually is quite broad and flexible. But you are expected to attest that you will use the funds in that way and that you will follow all applicable rules connected to this grant and also to any oversight agencies. But a couple of other attestations that I just want to call attention to. There will be one asking you to attest that you will maintain the salaries and not furlough any employees that are not asking for that. So, you know, you would keep all staff who would like to stay employed on board and maintain salaries. The second one is there is a very general attestation around the extent to which you are willing to support families with tuition relief. We at the state do continue to pay the parent fees right now. And we have talked to our program officers about the fact that on statewide level, we are meeting this minimum requirement because we are covering parent fees for all subsidized families. So what you are really be attesting to is a willingness, as is possible for you, not a commitment to doing so, but just a general willingness to support families that do need tuition relief. And I mean, from what I've been hearing from the field, I think that this is pretty standard practice across many of our programs. But I did want to explain that that would not be a hard and fast commitment to doing anything above and beyond what you're doing, but a willingness to help families as is necessary. Sorry, just scanning the chat. Again, I definitely see some questions about payments, and I don't have a final answer on the payments. And yes, effectively, you do need to reapply each month, but it's not really a reapplication. It really is just you need to go into your application and confirm that the information is correct. So that should not be a time-consuming task. There's one question about using the grant to open a new FCC. Unfortunately, this funding is not designed for that. We are, as you know, as we move into the summer and fall months, we are going to be looking into ways in which we can a different approach to supporting new programs and opening up. So that is certainly something that we are thinking about broadly in the agency. But this is not the particulars of the grant. And then there was a question about how umbrellas and systems can work with grantees in applying. Each application does have to be at the site level. We know that there were some cumbersome aspects to the way this was structured when umbrella agencies were applying on behalf of their program sites. And we will work to make this as smooth as we can with lessons learned from that, but it does have to be a site-based grant application. And in terms of where you go to the application, there will be we're looking at a few different options. We will absolutely have a link to that site on our webpage. That is, in fact, a federal requirement. And we will also put out a lot of information about where and how to find that in the advance of the application, both from us directly and through partners that we're working with. Yep, and part-year programs are welcome to apply. I think the only caveat I would say for a program like an after-school program that just is never open in the summer, we would ask you to wait to apply till September when you reopen for the school year. And there are a couple of questions in Spanish that it would be helpful to have translated.
So Leica Bautista, how can I use this grant, or in what?
Okay, so I will speak to that in just a minute. And the second one?
Do you have the name of the person?
It's an anonymous attendee. It's the most recent one that no, it's not the most recent one anymore, but it's almost the most recent one.
Is the application available now? When can we start? When will the payment start?
So the application is not yet available. We're still developing it, but we will certainly make it very clear when it becomes available. And then the payments, there will be a period of review and then a notification of your award amount. There will be certainly a processing time. And I don't have the specifics on all those timeframes yet because we are still working out the process, but then you will receive funding. I'm going to move into the funding, sort of how the funds will be used and how we're tracking that, and then I will come back to questions. So we are interested in checking at all of the information that we're collecting, both at the midpoint, so about 3 months into the grant process, and then again at the end. We both want to understand the trends we're seeing in the information that I just discussed, but also start to understand how the funds are being used. We will not be collecting a budget as part of your application. There will be a very brief section where you just indicate in these categories that you see here, which ones you're thinking about using the funds for, and confirming that you plan to use the funds for at least one of these categories. But we will wait until the midpoint to start getting some basic information just about how much money you're putting into general categories, and to the extent you are using the funds to support educators, how many people you're supporting through that funding. So the federal guidelines, I think you can see the categories here. I don't think I won't read each of them because you've probably been reading them while listening to me talk. But broadly, you can put funding into supporting your staff and your educators, including bonuses and stipend and professional development. There are a number of different ways you can use the funds to support your facilities costs. There are also you can also use the funds for continued COVID costs, both in terms of PPE and other equipment and supplies that are necessary. You do have the option of paying yourself back, and there's a very broad line about goods and services that are necessary to maintain and resume childcare services, as well as mental health supports for children and employees. So in general, this is should allow a fair amount of flexibility. We are not setting any requirements ourselves on how the funds use, nor the timeline in which you need to spend the funds. So even though you get a payment for July, that doesn't mean you need to spend the funds in July. Nor is that something that we would be looking at and understanding interim grant reporting. We just really want to understand how funds have been expended. Don't see any new questions. I will scroll back up through the funding questions and make sure I've answered the question. A question about receiving extra funding for an assistant that you've not been able to utilize. I think that it really depends on whether the assistant is employed at the point in time when you apply for the funding. A question about if someone needs help with childcare fees, can we do this if we are an agency? We aren't supposed to be cheaper than the state's rate. There is currently a waiver on that requirement. This is a requirement that comes from OSD, which I believe stands for the Operational Services Division or Department. We have had a waiver in place so that you can, in fact, right now, charge families less than you are paid by the subsidy, and that waiver has been extended, so you can continue to do that. I think I have covered all of the funding questions. If I'm missing something, please go ahead and put an additional question in the Q&A. I am going to start at the top and scroll down again. Oh, paperwork. Yeah, somebody's asking about receipts. You should keep your paperwork on how you've used the funds. We are not going to collect that, but that is certainly necessary in the event that you were ever audited so that you could demonstrate how you use the funds. And yes, you can reimburse yourself for COVID costs in the past year. It is allowable to reimburse yourself for prior expenses with this grant funding. Anybody else see anything that I've missed from the others that are keeping track of the Q&A? I think I may have answered all the questions. Nope, one more just came in. How can regulations or policies established by the legislature be waived if the COVID state of emergency is over in Massachusetts? The COVID state of emergency actually enacted particular, I'm losing my words, but particular responsibilities and abilities for the governor and the state agency, which did end when the state of emergency ended. If you receive the state, either the FCC facilities grant that we put out in the spring, or the workforce grant that we put out in spring, you can still apply for this one. These are separate grants, and you are eligible for both of those. And there's a question if an FCC can use these funds for salaries. I realize I don't actually know the answer. I mean, certainly salaries are an allowable expense. I think it probably depends on how you structure your program's budget. So I do want to be careful in answering that one. But certainly if you're a salaried employee of your program, you can use it for your own salary. Alternatively, you could use it for other expenses that would shape the income that you receive from your revenues and the balance of your revenues and expenses. Could I get this last question translated?
Which one of the two of them?
Oh, there are two? Probably both.
Okay, so the first one is, my husband is waiting for his certification as an assistant. Can he work with me and qualify once he gets it so I can add him as an assistant?
I would check with your licensor on that. Certainly once he is able to work with you, you could add him. I don't want to misspeak on what is required to be able to work in your program. And the second one?
I'm just hoping that the application for the funds is clear and easy for everyone, not as complicated as the other ones. Thank you.
Yes, we are hoping that the complexity was in the way the budget was structured in the last one. And we are going to put a lot of thought into not just how we structure the questions, but the type of guidance that we provide in understanding how to answer the questions, as well as some additional support that would be available to help the field understand the questions that we're asking and what we're looking for and how to complete the application. I believe one more came in Spanish. Ms. Marty. And while we're waiting on the translation, I will just answer the last question, which is when is the application coming out? As soon as we can complete it, we do have to design it and test it before it can go out, and we do want to get it to be accurate before we post it. There's one last Spanish question from Ismardi Lospez. Would it be possible to get that translated?
How can I apply for the subsidy that was given in the spring?
That application, unfortunately, is closed, but you are eligible for this. You are welcome to apply for this grant funding. And I don't know how long it will take for the money to be released after the application is filled out, but we will provide you with information. Another question that I believe is about whether your the actual number of children you have attending currently will influence your base rate payment, and the answer is no. Regardless of how many children are actually attending, we will pay for the full estimated capacity of 10 for an FCC, or for a center-based program, whatever your license capacity is. Programs are eligible to apply regardless of whether you have children with subsidies, and you do need to apply to receive the grant funding, and you need to just keep your application up to date over the course of the 6 months. Right. Well, we are well over time at this point, so I do want to thank everyone for attending. I'm happy to stay on for a few more minutes if there are additional questions, but definitely do not want people to feel that they need to stay at this point. Thank you very much for your attendance, and certainly we will continue to find ways to communicate and support the field in understanding and engaging in the application process.